Hi, my name is Christine DiCarlo, and I'm with the American Association of Colleges of Osteopathic Medicine, or AACOM. And today I'm here to interview Haris Ahmed. Haris is a recent DO. He recently graduated from the Burrell College of Osteopathic Medicine in New Mexico, and he is also AACOM's current Osteopathic Health Policy Intern, or as we call him, our OP. Today I'm going to interview Haris about his interest in advocacy and policy, his OP experience, and his plans for the future. Haris will be joining the Loma Linda University program in Southern California for residency later this summer. So congratulations to Haris on that. He'll be pursuing ophthalmology there. Before we get into the interview, I should also mention, usually when we conduct these interviews, we're together in person, face to face, but as our country is continuing to respond to the COVID-19 pandemic, we're still observing social distancing. So we're going to conduct this interview safely via video conferencing to make sure that we're doing everything we can to help keep people safe. So moving ahead into the interview questions, Haris, even before you joined medical school, you've always been passionate about advocacy, working to advance health policy issues at the local and the state level. What first interested you in medicine and health policy?
Yeah, first I just want to say thank you for having me. And virtual is good. In person would have been nice, but this is just as good. And for me, in terms of medicine, my parents, they always emphasized education because neither of them were able to graduate from college. So they always kind of had that focus with me. But there was a particular incident for me that really inspired me to pursue medicine, and that was really related to my younger brother. When I was 12, my younger brother was about 5. He was playing in the garage and he picked up a baby rattlesnake, and he decided that it would be a good idea to shake it. And the baby rattlesnake bit him. And for those who don't know, baby rattlesnakes, they don't have as much control over their venom. So when they bite, they tend to inject all of their venom into the person that they're biting. And so my brother screamed, but no one was really there. So my dad came and got him and, put him to sleep in the living room, not really knowing what happened. And my brother fell asleep. And then my dad had an unexplained urge to go look in the garage to see, if there was anything odd happening there. And he sure enough found the rattlesnake there, which is also interesting because typically rattlesnakes will leave the area. It had been a few minutes, but the rattlesnake was still there. And so my dad, he called 911, and the paramedics came and they flew my younger brother in a helicopter to Loma Linda University Medical Center, where luckily there was a world-renowned rattlesnake expert, Dr. Sean Bush, who took care of my brother. And it wasn't just a small case. They actually did an Animal Planet documentary on this case, and they interviewed my family, and Dr. Bush came and we did some scenes in our front yard. It was really interesting. And up until that point though in my life, back to when we were in the hospital, I really looked to my parents to provide kind of comfort and a sense of guidance in all situations, as all children do. But it was the first time really where I felt that my parents themselves were panicked when my brother was there at Loma Linda. And it was Dr. Sean Bush who really gave me that sense of comfort and control in the situation, and he saved my brother's life. So after that experience, I was really inspired that I wanted to provide that comfort for other families, and I wanted to be able to save other people's lives as well. And then in terms of my advocacy journey, that started much later. I would say I did a master's in public health at the University of Southern California, Keck School of Medicine. And I was really there where I learned the power of advocacy and how you can really affect populations and communities at a time through advocacy. And we had one particular trip which was very inspiring to me. Is we went to Sacramento for a conference, which is the state capital of California. And after that conference, we met with various people, including Dr. Karen Smith, who was the director of public health in the state of California. We met with state legislators and their staff. And when we were there, we focused on many topics, one of which was the physician shortage. And when we were there, there's about 15 students that were attending these meetings, and I was the only one pursuing medicine. And I felt that many perspectives were being shared on how to address the physician shortage. One solution was to allow non-physician providers to practice independently in shortage counties, like the one that I was from, San Bernardino. And I felt that the solutions were kind of being discussed with economic and business, administrative, insurance considerations. And I felt that the physician and patient perspective was not adequately represented. So, that experience really made me want to stay involved in advocacy, forever, because I wanted to increase physician representation, and I also wanted to represent individuals from under-resourced counties like mine.
Thanks, Haris. Yeah, that's certainly a compelling story. Your journey to medicine and advocacy are both very interesting. So thank you for sharing. So while you were in medical school, you've led student advocacy efforts by creating talking points, organizing committees, and meeting with your governor's office. Drawing on this experience, what tips would you share with other students to help them more effectively communicate with their policymakers?
Yeah, I would start with the intangible things. I would say number one is always remember that our priority is patients. They're the number one goal here. And number two, to be really genuine and sincere in all the interactions that you have with people. And number three, to really consider diverse viewpoints because other viewpoints may enhance your position or even change it for the better. And I think if you have that kind of balanced, sincere, and a personable approach, that it will really make you memorable. For example, in my first year of medical school, I attended AACOM's COM Day on Capitol Hill, and I met with Senator Heinrich's staff, and we discussed teaching health center graduate medical education. And a year later, I visited the same staff again for DO Day on the Hill, which is held by the AOA, and his staffers remembered me. So it really shows that meaningful relationships are important, and people remember that. More practical things that I like to recommend are understanding the importance of political capital, meaning that you should really prioritize your time and resources according to kind of a tiered system that you may create for yourself. And I can give an example for that. In my advocacy work in New Mexico, we had multiple goals, but we prioritized things. So when we met with the governor's office and when we visited the state capitol in person, we really focused on service-based loan forgiveness programs because that was our top priority. And we felt that other things we could really address through email or phone call. And I think that's really good to have that tiered system. And that also really brings me to another point, is that when you do meet with legislators, I think it's really good to talk about and focus on what you're doing for their community and their constituents. Whenever I met with legislators in New Mexico or when I'm in DC, I really start by focusing on what we're doing. And in Las Cruces, we created a pre-med program. We had a linkage program in the local high school. Our school had created residencies. We were mentoring kids in elementary school, doing fundraisers, so on and so forth. I really focused on those things that we're doing on the ground because it really gives you a sense of legitimacy in the eyes of the policymaker. Your asks are now based off of practical experience rather than kind of a theoretical ask. And lastly, I would say is, to really use empathy. And what I mean by that is consider your policymaker and their campaign and their optics and the fact that they want to help their community. So align your goals with their goals. And in New Mexico, Medscape has published data on this, and there's been so many surveys showing that New Mexico is one of the least desirable states to practice medicine. So when we were discussing physician-related policies with legislators, we'd really emphasize how supporting our legislative items are going to make the state more attractive to physicians, which is going to stimulate the economy and most importantly, make the state healthier.
Harsh, those are excellent points. I know it can be kind of intimidating for students to go in and try to advocate, so this will be really helpful for everyone watching. My next question is a little more focused on specific policy issue. So preserving the Public Service Loan Forgiveness Program, or the PSLF program, is a current policy priority for the Ed to Med campaign, and this is also an issue that you advocate strongly for. When you're communicating the importance of PSLF, how do you get the message across that this is a program worth fighting for?
Yeah, so in addition to supporting the great work that Ed to Med is doing via their social media platforms and participating in their advocacy projects, what I try to bring to the table is something unique, and that's my personal perspective, and that's what I used to highlight the importance of PSLF. For me, my experience is, it starts in undergrad when I traveled to rural Guatemala 3 times with a nonprofit organization called Humanity First, and we traveled there to conduct surgical and medical camps. And when I was there, it was very humbling to see how certain communities in Guatemala had a very strong lack of access to basic care. And when I went to New Mexico for medical school a few years later, I was surprised to see that, again, there were certain communities within New Mexico that were not really too different from rural Guatemala with respect to access to care. And seeing that really sparked my interest in finding ways to help retain physicians in the state of New Mexico. When I went into medical school, I applied for this program called the Domenici Scholar Program, which is conducted through the Domenici Institute of Public Policy. And they select policy students from the state of New Mexico to work on various policy projects. And if as part of my work there, I focused again on increasing recruitment from underserved communities to medicine. And I issued a survey to students in New Mexico, medical students in particular. And in my survey, I found that over 90% of respondents were interested in service-based loan forgiveness programs in general. And to me, that really made it abundantly clear that programs like PSLF, they're going to play a critical role in mitigating the physician shortage and increasing access for these communities. And really eliminating PSLF would honestly be a pretty heavy blow to underserved communities that is going to rely on these programs. I think the discussion shouldn't be whether or not we should eliminate, but how can we expand and how can we support PSLF? And I think lastly for me, PSLF's importance is a philosophical one, and that is because PSLF to me, it's not a handout or a bailout. To get loan forgiveness, you have to, as a physician, you have to commit to a high need area for several years, and you have to serve that area. You're not just getting a get out of jail free card. And so in that way, really PSLF benefits everyone, communities, physicians, and our public health system.
Yeah, certainly it's a very important program, especially like you say, for these rural and medically underserved communities that are just hard hit all the time. I mean, certainly right now during COVID-19, the need is even more pronounced. So, to kind of dovetail on that point, as you're advocating for PSLF, at all levels, federal, state, local, you're always citing the importance of the program to the rural and underserved communities. Why is it so important for you to advocate for these medically underserved communities?
Yeah, for me, it's critically important because I grew up in a medically underserved region. When you think of Southern California, you tend to think of, palm trees and excessive wealth, but that's a generalization. And many areas do have, a lot of affluence, but counties like Riverside and San Bernardino County, relatively speaking, are not that well off. And I have many examples of my family and friends who were delayed in access to physician care, and their delay in access to physician care was to the extent that there was mismanagement and there was delay in care that complicated diagnoses, and it led to increased costs for everyone, my family and the healthcare system. So I think it's really important to recognize that medically underserved communities, it includes rural regions, but it also includes other areas such as the borderlands, certain inner cities and urban communities as well. And really, ensuring that these communities have access to quality healthcare is critical if we want to mitigate health inequities. One of the fundamental beliefs that I have is, we cannot take shortcuts when it comes to increasing access to healthcare for these communities. That means we need more physicians, both specialists and primary, to solve the physician shortage. We need more advanced practice providers such as nurse practitioners and PAs to solve the advanced practice shortages, and RNs to solve the RN shortages. I think where issues arise when we try to mix and match the roles, because every member of the healthcare team, whether it's a physician, a nurse, or a technician, they're all important, they're distinct, and they're all uniquely trained. And I think, when we're maximizing access to care, it's going to require investment, and it's going to require expansion of beneficial and proven programs like ones we mentioned, teaching health center graduate medical education and PSLF. And really, we have to remember that when we mitigate health inequities, we're maximizing the ability of everyone to meet their personal, physical, economic, educational, and spiritual potential, which is extremely important.
Yeah, that is a great point. I mean, we're definitely seeing right now how interconnected everyone and everything is. So addressing each issue is really critical to health and safety and everything. So Horace, my final question for you. As a physician, you plan to remain engaged in advocacy, ultimately working toward teaching health policy at a school of public health. How do you plan to continue advocating throughout residency and the subsequent phases of your career?
Yeah, I definitely plan on remaining engaged through various policy organizations and assisting associations like AACOM in any efforts that I can. And I think continuing to raise awareness via publications and social media is extremely important as well to me. And most important is kind of utilizing my direct experience that I accumulate during residency and as an attending in the future to really inform my policy pursuits. And for me, I'm training in my home counties for residency, both of which are medically underserved. And people tend to think of Southern California again as a monolith, but within California, it depends on what county you're in. Life expectancy can be as high as 90, or it can be as low as 74. So even within counties, sometimes there's as high as a 12-year difference in life expectancy, depending on your ethnicity. And my home, the Inland Empire, as we call it, has an average life expectancy that's significantly lower than the neighboring Orange and LA counties. And we have a significant shortage of physicians, to the extent that we've had 3 new medical schools in the last 5 years alone that have opened. And I want to continue to advocate for counties like mine because of the position I'm in and the opportunities that I've had. I think it's really, really critical for physicians to remain involved in advocacy, because I think we have a unique and well-respected expertise that's valuable to public health and healthcare and health policy discourse. And as we've seen, if we don't advocate and we're not present at the table, decisions will be made without us. And that's why my goal is really to share the physician perspective by being active in associations, visits to policymakers, and I would even love to teach health policy at a university or college.
That's great. Yeah, I would agree. I think the physician voice can be very strong, certainly well respected. So it's great to hear you're going to continue on your advocacy journey throughout the years. So Horace, thank you so much for answering all my questions. It's been great to talk with you. For anyone listening, watching, if you're inspired by Horace's story and you want to advocate on these important issues, please join the Ed2Med campaign. It would be great to connect with you. You can find us online at ed2med.com. We're also on social media. We're on Facebook and Twitter. That's a great way to connect, stay educated on the issues, be alerted to all the advocacy opportunities, and to meet other advocates in the network. So certainly connect with us on there. And thank you all for watching, and thank you again, Horace.
Thank you for having me.